Hi, everyone. It's the beginning of the mental lecture. I am Dr.Gezira, an owl psychiatrist.
Nice to meet you. My name is Rebecca.
Do you have anything to ask today?
That's right, that I'd like to ask you something. My friend seems to be having a hard time because some people get irritated by the sound of other people's lives. But I'm troubled because I don't understand that feeling.
I see. It may be a phonophobia. It is also said to be hypersensitivity, phobia, etc. A medical disease that is rarely diagnosed is called misophonia.
I've never heard of misophonia.
It is a disease that is very sensitive to unpleasant sounds and reacts emotionally.
I would like to know more about misophonia.
Today, I'm going to talk about this misophonia. Also, let's talk about auditory hyperesthesia, a similar disorder.
Thank you for your cooperation. First of all, what is misophonia?
In response to the common sounds of life that others make, they overreact and feel a strong sense of anger, rejection, and disgust. In severe cases, some people can't control their anger. That's the symptom called phonophobic misophonia.
Is it a disease?
Yes. Misophonia reacts sensitively to all sounds. It is said to be one of the mental and brain diseases. It's an emotional problem caused by a particular sound. It is by no means a matter of hearing. It is considered one of compulsive disorder, which causes hyperventilation and panic symptoms.
It's an unfamiliar word, but when did it become known?
Misophonia is a disease that has recently been brought into close-up. So the research has not progressed yet. It has been said that it became known worldwide since around 2010.
Recently. Now, let's take a look at what kind of symptoms does misophonia specifically show?
Misophonia people hate different sounds, whether it's small or loud. For a particular sound, negative feelings such as anger, strong fear and discomfort, feelings of hatred and disgust, and instinctive escape reactions to avoid stress occur. And it causes palpitations, sweat, trembling hands and feet, hyperventilation, muscle tension, heart rate rise, panic attacks, etc. When it gets worse, they start to use violence against the person who is making the sound. It can lead to self-injury.
Why does such behavior occur?
People and animals are too strong for themselves to hold on to themselves. If you have enough emotions to feel, this time, it is designed to show some symptoms on the body. For example, if you get too scared, you'll tremble, it's too disgusting to vomit. And you'll panic and act strangely that you can't normally think of. I have feelings that go beyond my capacity. People can't handle it by themselves, so something unusual happens to their bodies. This is not unusual at all, so we have to wait for the emotion to subside.
What specific sounds do people with misophonia respond to?
The people of misophonia have a strong rejection of all the sounds and distractions of other people's lives. And they are fighting their uncontrollable emotions every day. For example, drinks, chirping of ice and candy, breathing, coughing, conversation, sneezing, burping, yawning, singing and laughing and typing on the computer. There is no end to it, and this is not everything. So you should think of it as the general sound of other people's lives.
It's pretty painful. What is the difference between a person with misophonia and a person without it?
The cause of misophonia is still in the process of research. But in February 2017, Newcastle University in England investigated brain changes in people with misophonia using MRI. The results of a study show that there are differences in the structure of the frontal lobe of the brain, and the activity of the brain between people with misophonia and those who do not. According to the report, the frontal cortex of the brain, which is responsible for emotions in people with misophonia. When you hear a sound, you become extremely active. And you have abnormalities in the emotional suppression mechanism.
It means that the brain of a person with misophonia is not functioning properly because of something innate.
That's right. If you don't know that a person with misophonia has such a brain disorder, many people will have a negative image of a person who is short-tempered and hysterical or stressed. However, it is important for people around you to understand that there are people who feel a lot of mental burden. due to small environmental sounds and living sounds, and to be considerate.
Right, I didn't know. Then, which hospital should I go to if I wondered if I have misophonia?
Misophonia has yet to establish a cure. So maybe you should go to psychiatry, psychosomatic medicine, neurology, etc. However, it seems that misdiagnosis of misophonia is one of the symptoms of developmental disorders, auditory hypersensitivity, so be careful.
Is misophonia different from auditory hypersensitivity?
It's similar, but it's different.
Now, I would like to ask you to explain the difference between misophonia and auditory hypersensitivity. First of all, what is auditory hypersensitivity?
Auditory hypersensitivity is considered one of the developmental disorders. And because all sounds are picked up and cannot be selected, it is considered that the surrounding sounds are too audible to distinguish between individual sounds or too sensitive to a particular sound.
Well, the difference between misophonia and auditory hypersensitivity seems difficult.
Yes. The difference is the difference in the volume that triggers. The difference in how you feel depending on the volume. And the difference in the feeling you have when you hear the sound.
It's hard. First of all, how is the trigger volume different?
Many of the sounds that misophonia people dislike are soft sounds. Certain sounds that people with auditory hypersensitivity dislike tend to be noisy. That's because the sounds that auditory hypersensitivity people dislike are generally loud or noisy. On the other hand, in general, the trigger sound of misophonia is not noisy, because it is within the standard of the Environment Agency, which is less than 50 dB, and is within the range of so-called living sound.
Then, what is the difference in feeling depending on the volume?
The sound that people with auditory hypersensitivity complain about is, the sound is sharp and painful. The sound of the air conditioning go-go-go is stuck in my ears. When I go out into the city, my ears throw away all the noise, so I can't stand it. Children's cheers and babies' shrill cries are killing my brain. Even a small sound sounds loud enough to cover your ears. And so on. It seems that they often act reflexively to cover their ears. On the other hand, in the case of misophonia, the volume you can hear is normal.
Then, what are the differences in emotions that you have when you hear a sound?
People with auditory hypersensitivity are said to have a great sense of shock and anxiety about being exposed to sound by loud sounds. In misophonia, on the other hand, as I mentioned earlier, reflexive anger after physical reflexes occur by hearing the triggering sound. And negative feelings such as struggle, anxiety, or escape. It is characterized by the aggressive feeling and guilt that you hate so much that you want to kill someone the moment you hear a specific sound. In short, you can think of the difference between I hate sound for misophonia and the sound hurts for auditory hypersensitivity.
I see. Are there any other differences?
Yes. Auditory hypersensitivity is characterized by poor hearing discrimination. People with auditory hypersensitivity may not be able to accurately recognize where and what sounds are coming from. This condition is described as bad auditory discrimination. There are times when hearing discrimination is bad and noise processing is hindered. And when someone calls their name, they can't pick up a call. On the other hand, there is almost no problem with this auditory discrimination in misophonia.
Now, let's take a look at There is a difference between how to deal with misophonia and how to deal with auditory hypersensitivity.
For auditory hypersensitivity, use earplugs or earmuffs for soundproofing. In many cases, measures are taken to reduce the volume. And noise cancelling function is one effective measure for hearing hypersensitivity. However, the noise cancellation function ensures safety in life, so unfortunately, there are many products that cannot erase the sounds that people with misophonia don't like. Rather than creating silence, misophonia is recommended to actively incorporate distractions that do not bother you.
We can't tell the difference between misophonia and auditory sensitivity by appearance. So I think it's hard to understand, but what should we do to get people around me to understand the sensitivity to sound?
If you really need to gain understanding at work or at school, there is a way to get permission to wear hearing protective equipment with a medical certificate and a help mark.
What is a help mark?
Help Mark is a tool that helps people understand. In Japan, some of them are distributed from each prefecture. Thankfully, the website of Ishii Mark Company, Limited is also provided free of charge. There is also a symbol for the protection of auditory hypersensitivity. We would like you to use it.
To sum up, misophonia needs to build an environment that incorporates noise. So it is necessary to build an environment that does not expose the aquatic person to unpleasant sounds for auditory hypersensitivity.
That's right. In either case, I would like you to avoid blocking information from hearing for a long time, because it may have a negative effect on the brain.
At any rate, the recognition that there are people in the world who have these worries. There is no doubt that it will be important to expand it in the future.
There are many different people in the world and they have different sensibilities. It's very important that we accept each other's differences.
Thank you again for the easy explanation today.
Was it helpful for everyone? I will continue to speak out to help you have a better day.
I would appreciate it if you could sign up for a high rating and a channel.
See you in the next video.
Goodbye.
Goodbye.